I wanted to get into my truck and drive the countryside and take care of large animals. That's the thing about this profession that is so fun and unique.
Welcome to Dogtors Without Borders, the official podcast of the MSU College of Veterinary Medicine. I'm your host, Kristen Lair, and today we have an exciting conversation lined up with Dr. Tory Watson and Dr. Julie Strachota, both specialist veterinarians in anatomic pathology and theriogenology, respectively. But their impact extends far beyond their clinical expertise. They also serve as directors of our preclinical and clinical education programs. Drs. Watson and Strachota, welcome to the program.
Thank you.
When did you decide that teaching was something that was exciting to you?
It actually was before vet school. I was a peer teaching assistant for a biology lab my last year in college and really fell in love with teaching. I also had an amazing English teacher in high school. So I really, really loved teaching to the point that in college I actually did both English and all my pre-med because I was kind of like thinking about vet school, but also thinking about potentially being a professor in college. And then, of course, when I met all of the wonderful professors, the faculty at University of Georgia, where I went to vet school, that really then became what I wanted to do, you know, the people I wanted to be in the future.
So I share a little similar and then different story in my journey in education. So I actually did a year and a half in the College of Education here at Michigan State University. So I wanted to be a middle school science teacher. And I also wanted to explore special education. And so I did that for a year and a half and then made my transition over back into veterinary medicine, pre-vet. And I always have loved teaching, mentoring. Before going to vet school, I was hired here as a working student in large animal clinical sciences in the hospital. And I started to develop those same relationships, mentorships, and my desire to be like my mentors and to give back to the community and to the animals.
So other than your mentors that you had and you wanted to be like, just like with me, when did you decide to like actually stay in academia?
So for me, I honestly didn't think I was going to stay in academia. So after vet school, I transitioned into being an associate veterinarian up at an equine-only practice here in Michigan. I stayed there for about 3.5 years and then had the opportunity through my mentors to come back to the university to start to really explore my role as an educator. So yeah, I did not think that my journey would actually lead me back here necessarily, but I am so fortunate and thankful to be here. How about you? Did you always know you wanted to be an anatomic pathologist?
Okay, so the anatomic pathologist, I actually think I knew I wanted to do education for longer than I knew I wanted to be an anatomic pathologist. Like, think so many of students going into veterinary school. I did the whole thing of, if I don't make it into vet school, I guess I'll go to medical school. Like, I think a lot of us have that sort of story. And at that time, when I was saying that to myself, I was reading a book on forensic science, forensic medicine. And so when I did get into vet school and then was introduced to pathology in my second year, I was like, oh, this is perfect. This is exactly, the thing I thought maybe I would do if I had to be a human doctor. And then mixed with the pathology of, being able to really dive deep into disease and the mechanisms of disease. So that's really why I ended up becoming a pathologist. When I started vet school, I knew I didn't want to be just, quote unquote, a small animal practitioner, but all of my experience was with small animals. So I knew I wanted to do something. I thought specialize in something, but it wasn't until my second year that I was like, oh, that's it. That's what I want to do. Yeah.
I was a little different. I had no idea that I was going to come back to do a theriogenology residency and a therio specialist. I wanted to get into my truck and drive the countryside and take care of large animals. And that's the thing about this profession that is so fun and unique, is you can change your trajectory and really follow the things that you love and are passionate about.
We may have some folks listening that don't understand what an anatomic pathologist or a theriogenologist is. So very briefly, tell me what that means.
So an anatomic pathologist is a veterinarian that looks at tissues of animals that are either getting a biopsy, so having a piece of tissue removed. So I am the one that then looks under the microscope to figure out what that tissue was. So, either inflammation or a type of cancer. So I diagnose that. And then I also do autopsies on all creatures, great and small. So that's the role of an anatomic pathologist.
As far as a theriogenologist goes, I like to equate it to the animal version of an OBGYN. So I am all things with the reproductive system. And so, but that's both male and female. But usually here at the university, we're looking at those animals that are not obtaining or achieving pregnancy and what we can do to try and help that owner achieve those goals for that animal.
And I know you work with horses a lot with the therio, but do you do other species or work with any of the other ones?
Yeah, I do. And probably my favorite thing to do is to actually go to the zoo and work with colleagues there, because that's a great way to take our domestic species and translate that to exotic species. But I mainly do large animal, and I would say bovine and equine, but we are trained in all species, so a little bit of canine and feline as well.
That's right. I do vaguely. I remember when, was it Javi was born, the rhinoceros at Parter Park?
Jolly.
Jolly.
Yeah.
Yes,
Jolly.
You were involved with that.
Yes, I get to actually see Jolly on transrectal ultrasound before, while he was in his dam, so Dopsy's uterus. I was able to see him. That was a great experience.
How do you learn and continue to grow your skill and training as a teacher, not just as a veterinarian?
So I am always trying to improve how I deliver my material, and I try and make it more exciting. And Dr. Watson might laugh at this, but it's actually in her course because I teach equine dentistry for an hour. And I actually bring my tools into the classroom, and I actually engage them, which some of them sound like a drill. And students wake up, they start laughing, they start to smile, but get them interested and see this is actually, and I hand it out and they physically get to touch those things, right? So trying to get their hands, get their eyes involved. And so I think one thing that I have really enjoyed is spending time in the classroom as a student watching my colleagues teach and doing some of that peer observation of learning. I have really enjoyed and learned from that to see what others do in the classroom and how can I incorporate that into my teaching.
Yeah, I love seeing you come for your equine dentistry class, because she comes in and it's, January, it's really cold outside, carrying a giant horse skull and then drills. What to me looks like drills, because I don't do dentistry. But yeah, so it's great. And I think, the students love that hands-on. And then I totally agree with you about the peer observation, like seeing what other faculty are doing has really helped me grow as an educator. As the person that's somewhat new into administration, so I've only been in this position as director of preclinical education for 2 months. Can you define for the audience like what administration means in a vet school?
Great question. So administration really means we're really overseeing the whole cohort of students, trying to problem solve and really progress the education and the opportunities for the student. So not only dealing with individual students, but thinking about the entire cohort. We also have an opportunity on the clinic floor that we actually take students from other institutions. We call those affiliate students. So I get to introduce students to Michigan State University for their clinical year as well. But the administrative side it's more meetings, but it's also, I think, very rewarding, because when we talk about having an impact, We're trying to diagnose problems just like we do as veterinarians, diagnose the problem, diagnose the disease, and try and come up with a solution.
Yeah, I like we're looking at the big picture and seeing, what has been done in the past, taking that data and then using that to improve the curriculum and improve the clerkships, things like that. When Dean Dodd was asking me about this position, she said something along the lines of, it's going to be a tough 3 to 5 years, but at the end of those 3 to 5 years, you're going to feel so wonderful about the changes you've made. So kind of along those lines, like within the time that you've been the director of clinical education, what changes have you made that you're really proud of?
So, and exactly what you said, I feel like from the first day I started in my role as director till now, the opportunity and the amount of growth that I've had, and then the comfort, the biggest accomplishments are associated with our outcome measures. So we are about to March 3rd is a big day here for the clinical education. Our required clerkships have created very robust rubrics and outcome measures. And so we're getting ready to implement that different D2L. So that's our learning platform. And so our team has really been working hard to get that implemented and moving forward. So that's probably the biggest. I would say, like, my favorite part, though, is watching those students grow and develop in that last year. Their confidence soars in the last few months, and you can see that in their eyes. I'm going to ask you a question.
Okay.
What's been your favorite thing so far as the director of preclinical education?
Being able to see ideas I've had in the past start to come to fruition. For example, I was on the curriculum committee. So it's a group of faculty, some student representatives that review courses that have happened throughout the preclinical curriculum. And in my time on the curriculum committee, I was chair for 2 years, but I always felt like we were giving recommendations. It even says in the bylaws, like, the curriculum committee recommends these things. So I felt like I was making all these recommendations, but I couldn't see them go anywhere. So taking on this position, we're starting to make those changes. So during my time on the curriculum committee, we had subcommittees that were looking at the curriculum, doing a kind of more almost a full curricular review. And within those working groups, we worked on ideas for outcomes, also ideas for the structure of the preclinical curriculum. And so out of that, we had ideas to enhance the retention of the material students are learning. So that was looking at our systems-based courses in the first 2 years, which are currently running alone for 3 weeks. But 3 weeks is not a lot of time for these students to be learning. And then, this change happened during COVID and beyond. And so there would be students that miss 3 days. 3 days out of 15, that's a huge amount of material to miss from just being sick for 3 days. I mean, I had students that were out for over a week, and that's half of the class. So next year, we're actually going to implement concurrently running systems courses that are half semester long. So really giving the students time to digest the material, kind of think about it, reflect on it, and then hear it again a little bit. So that is probably the thing I am most excited about. So what do you see a challenge facing the education and veterinary medicine in general? So things to do in the future.
Yeah, it's a great question. I think we are going to be adopting more and talking more about artificial intelligence in that role, both in education as well as in veterinary medicine and how we treat our patients. I think that is a challenge and an opportunity as well, I would say. How can we use artificial intelligence to benefit us and to improve the care and treatment of our patients? So I think that's a challenge. I think another challenge is just changes in society. When we went to vet school, we went to school from 8 to 5, basically. Right. So now a lot of different programs are exploring other ways, just like you described here with the 2 to 3 week systems-based courses. And so I think we'll always be challenged as to how best to deliver that education.
Right.
How about you? Anything that you can see or concerns or areas of growth for veterinary medicine?
So I do see a need now and in the future to try and educate students about veterinary medicine, about all of the opportunity. Like, it's not just vaccines for cats and dogs. But I think we need to be doing that in elementary school and middle school, getting students really excited about science in general. And then also in that, like reaching out to schools that are in urban areas, schools that are in rural areas. Kind of, I'm just going to keep suburbia out of there, I guess, because then we can reach students that are underrepresented and also students that with the rural side of things, students that might want to return to a rural environment, because the challenge in vet med, not in education, but in vet med we're seeing, and I know you know this, is the agriculture animals and the care for ag animals is decreasing because many, many different reasons, but that kind of reaching out to those students that are in 4-H, something like that, they don't think about veterinary medicine, but they have that farm background, would be something that I think would be a great opportunity to increase the representation of farm animals and also with underrepresented minorities.
Yeah, that's a great point. Yeah, I think in general too, we talk a lot about the shortage of veterinarians in general, right? I think we saw that lots of animals, lots of pets in the world, but we need more people to take care of them. And so I think that's a challenge not only for veterinarians, but for our veterinary nurses as well. We need more veterinary nurses to help take care and support the profession.
So you kind of mentioned, this veterinary shortage, including veterinary nurses. And Michigan State actually has a 4-year undergrad program for vet nurses. How do you see the education? I think it's mostly in the clinical year that there's interaction, but the education of the vet nurses along with the DVM students, how that is enhancing their training.
I think we're so lucky and fortunate that we do have that team, the veterinary students, the DVM students working together. We talk to the DVM students all the time about how to best utilize the veterinary nurse and how to have them as part of your team and everything that they can do, the strong education that they have. And we're really unique in is that we're only one of 4 universities to have a 4-year veterinary nursing program. And I know for myself, I would be nowhere without my nurse, because they were the ones that organized me, kept me efficient, and they still today do that as well. But really in private practice, I really relied on them to keep me going and to also bill the clients as well. But they had so much knowledge and experience. And so, that's one thing here at Michigan State that our students are exposed to and embrace throughout their clinical year. So we are very fortunate to have the veterinary nursing program here at Michigan State.
So we talked a little bit about like how you decided to do Therio and how you decided to do academia. And we briefly mentioned mentors. But I really want you to talk about like someone that you really felt was a really important mentor that made you successful.
So I've had so many of them, but I am going to pick one. And this person's actually not a theriogenologist. So this person actually is a large animal internist, Dr. Hal Schott. So I actually worked for him before I even went to vet school. I was a research technician, and he was that person or that voice for me that told me I could do it. I will tell you, I didn't always know that if I could succeed as a veterinarian. I did not get into vet school the first time that I applied.
Me neither.
And so, but really trying to have that resilience. And so when I didn't get in the first time, guess what? I just worked harder. I started a master's degree here in large animal clinical sciences and just continued to fight and grow. And so Dr. Schott has always been there along the way to provide different opportunities, and he still does that today. So I've had some opportunities to travel and to explore different areas of even academia because of him.
I have actually seen a picture of you. I think you shared it, I hope, as I bring this up, of you when you were working with Dr. Schott, filling a horse colon with water to understand the volume contents, right?
Yes, that was me. I don't know if he ever published that. I will tell you I did get bathed at times in that fluid because they would explode. But yes, once again, kept learning. And yes, that picture is out there. Mm-hmm.
So I'm hearing that veterinary medicine is a humbling profession as well.
It can. Another person along my journey would always, when I was in private practice, they would say, and that is why we call it practice, right? Because we're always learning,
yes.
Right? We're always striving to do better. How about you? Do you have a mentor?
Yes. Yeah. Well, definitely a lot, just like you said. But I think that when I was at UGA as a vet student, I was introduced to pathology and the amazing teachers of pathology, first with Dr. Corey Brown. So she was the primary faculty that taught systemic pathology and general pathology. And she would have labs with all of the gross specimens. But I remember her telling me, and this might have been when I was a resident, but she would get a tissue that was normal if she couldn't find a good example of an abscess. So an abscess being a pocket in tissue that's full of inflammatory cells. And she would create an abscess with like yogurt and something red or pink to get that color of it. And so just like her mind of being able to figure out ways to do things outside of the box was really amazing. And then when I came back from my residency, I had a lot of mentorship with our residency coordinator, Dr. Buffy Howarth. She, her real name is Elizabeth, but she's always gone by Buffy. And she had a story about, this is a long time ago, but the movie Buffy the Vampire Slayer. She had a poster of that from that movie, but it said somebody gave it to her and it had crossed off the Vampire Slayer and wrote the pathologist. So she had Buffy the Pathologist poster behind her desk for a while. So she was a really wonderful mentor. And then lastly, I got to say Dr. Paige Carmichael. So also like none of those people have the focus that I have, which I love the gastrointestinal tract. That's the thing that I like in the world of pathology. One was kind of everything. One's a neuropathologist and the other one's an ocular pathologist. But just the joy that they have still with every thing that they do with students and with their path of diagnostics and research really, made me want to be like them.
That's fantastic.
How do you find balance between your love of being a veterinarian and the veterinary profession and being an administrator in the program?
I think my goal in this position is to build, adapt the curriculum, enhance the curriculum in the preclinical phase so that we are supporting students, but also keeping an eye on the fact that we want to graduate veterinarians that we are all proud of and that are going to be great veterinarians both day one and as lifelong learners to kind of improve themselves and continue to learn.
Yeah, I agree. I think the administrative hat, I feel like we have a role to talk to our stakeholders, including former alumni, and how can we improve our curriculum? How can I have different clinical clerkship experiences? Do I need to create other opportunities to ensure that those students have those opportunities to learn before graduation, so they can, like Dr. Watson said, be the best veterinarian that they can be?
So last weekend, our third-year students made that transition from the preclinical side of their education to the clinical side, and we call that our white coat ceremony. When they start clinics the following Monday, what is something that you are hoping for those students?
Yeah, so I always give them a piece of advice during orientation, and is that in those 3 weeks that they're going to be on that clerkship, that you imagine that that's what you're going to do for the rest of your life. So for example, I am a large animal focused vet student. I was a large animal focused vet student. So for me, small animal orthopedic surgery was scary. But if you live it and breathe it for those 3 weeks, you're going to be the best you can be, right? If you just believe that I got to get everything out of that, and study hard. And I think that that's one of those pieces of advice that will take you so far within your clinical years, because you never know. This is one of those professions. Maybe someday I'll be a small animal orthopedic surgeon, right? You never know. That veterinary degree, you can do so many things with it. So take the most out of it. You may meet a mentor along the way that's going to change your entire path. I didn't know I was going to do theriogenology. Did not take a theriogenology clerkship when I was in school, and here I am teaching it.
How do you express to a student who is somebody who probably aced undergraduate, that the grade is not the most important thing, but actually learning is?
So I was not a 4.0 student in undergrad by any means. But I had good enough grades that I could get into vet school. But I will also say I don't think I ever studied. Maybe organic chem. I studied for organic chem. But I did not have to work that hard in undergrad. And I've heard this from other vet students too. And then it was definitely like, you have to study. You have to keep up with everything. And not focus on that grade, because it is much more important that you learn the knowledge, you retain the knowledge for the future than anything to do with grades. So definitely that. And I would say, like, I did not get that many A's in vet school, and I still have gone on to know a lot of information, go on to do my residency in pathology, go on to do a PhD in gastrointestinal diseases. So they can do it, and they don't have to get A's.
Along those same lines too, when you have a client bring their animal in to be treated, they don't care if you got a 4 point in physiology. They want to make sure that you're competent and that you can do your job well. They don't care about your grade. They want to make sure you know the material and that you can utilize the material. We talk to students on the clinic floor about that too, because some of our students are going on to internships and more advanced training through residencies, and they are worried about their grades. But the letters of recommendation are just as important, if not more important, than that grade. Is can you apply that knowledge? Do you know it? And how do you demonstrate that?
So what I'm hearing is grades are important, of course. We all know that the grades are important, but achieving the grade, doing what you need to do in order to pass the test, is less important than learning the material, retaining it, so that when you're treating a patient later on, you remember all of the things you learned and you can apply it to that case. Is that right?
Yes.
Yes.
So I have one last question for the two of you. What was your favorite moment as a teacher to date?
So it's a little broad, but my favorite moment as an educator and in my role as Director of Clinical Education is graduation. And reading off the names of those students that are now my colleagues, that are veterinarians, and watching their families celebrate this accomplishment, by far, that is my favorite overall experience here at Michigan State. I will say, as a clinical educator, I do something on my clerkship. So on the equine therapy clerkship, probably my favorite moment is when they finally show me an ovary on an ultrasound. I take a picture of them with the ultrasound. So it's their first moment where they have actually been able to identify the ovary. And so I just try to, fun moment, a moment that we celebrate, because sometimes that might be halfway through the clerkship before we reach that achievement.
Okay, well, I don't know if I can follow the graduation as the best moment, because that's pretty impactful. But I would think for me, it is the smaller group activities. So when I am on the autopsy floor, we have clerkship students, so such students that are in their clinical year. And so working with them and having them, find the abnormal within an animal's body to be able to identify that, why the dog passed away, and understanding the importance of that, the interest in the lesion, but then also the importance of being able to give the clients, the owners, an answer as to, why did my animal die? So it's seeing them realize the importance of that as part of their potential career too.
Absolutely. I know for the students, it's one of their favorite clerkships is actually going out to the necropsy floor and getting to see those gross lesions, that you don't forget that.
That wraps up our conversation with Dr. Tory Watson and Dr. Julie Strachota. We hope you found their insights as valuable as we did. If you enjoyed this episode, be sure to follow us and share. And as always, stay connected with the MSU College of Veterinary Medicine for more stories, research, and innovations shaping the future of veterinary medicine. Thanks for listening, and we'll see you next time.